I'm actually very privileged to be able to lead a global business like GSK Vaccines business across the world. And I'm 25 years with this company. And last time I was speaking here, I was still head of pharma Europe. But I must say, running vaccines is very special. Special why? Not just because we are headquartered here in Belgium with 9,000 employees, worldwide 16,000 employees, making millions, 800 million vaccines a year, shipping to 170 countries, managing 16,000 very talented people in R&D, manufacturing, commercial, quality. But we have an amazing impact with vaccines on the world. I don't know if you realize, and Belgium plays a very important role in that, 70% of the vaccines that we produce are shipped to the developing world. I mean, I was myself with Minister De Croo earlier this year in Conakry, Guinea, to experience what it is, how devastating Ebola is. We visited an Ebola center. But at the same time, I was impressed about the impact of vaccination, what it can do on the ground. So that's why I think working in vaccines is very special. And today we talk about Sustainable Development Goals and the fact that we are all here, and I think, Eduardo, you said it very well. There are 17 goals now, there were 8 before, but health is really the only one that should cut across. It's just not number 3, it's actually cutting across to be able to realize all of those initiatives that are put forward. So when I've looked into the Millennium Development Goals, and you touched already up on it, Professor Timmerman, yes, we need to be happy of where we are, but it's not good enough. And I hope we all agree it's not good enough. And the Sustainable Development Goals are a new challenge. And if I see how many organizations, if you just take the slides that have been shown, all the organizations, all the nations, everybody who's working on it, I'm a bit scared of that. Why? Because we can all talk about it, but how are we going to make it happen? And today I want to talk a bit about the importance of vaccines. I want to touch upon 3 points. Why vaccines? Why immunization? Because Nelson Mandela said it really, your life or death of a child depends on where you're born in the world and if vaccines are available to you, yes or no. That's the importance of vaccines. So I want to give my perspective on 3 areas where I think focus is needed to drive progress in health, and then also some challenges, not only to you, but also to ourselves. The first one is the commitment to immunization. There are many initiatives, but the real question is about who holds who accountable so that immunization really happens. The second one I want to talk about is the role of the private sector. Dr. Pisani, you have spoken about the role of the industry, but what does it really mean? Is there a contradiction between doing business and doing well for the world? And thirdly, we've heard it, collaboration, but what does it really mean, collaboration? And so I hope I can share a bit of that with you. So firstly, why choose immunization? Just a number, every year we protect 3 million children from dying by using vaccines. Let's not discuss cost effectiveness of vaccines, it's proven. I invite you to read the UNICEF report on vaccination, where we clearly show the impact of vaccination. $1 investment in a vaccine returns $44. So let's not have that discussion on, is it cost effective, yes or no. Everybody also agreed that the best investment for a government is first immunization, healthy communities, and then you can have a healthy economy. But you know what? Today, 1 in 5 children is still not reached, is still not vaccinated. And last year in Milan, actually, I gave a talk. It's not just the developing world. Just go to Eastern Europe. I mean, why are we still seeing outbreaks of measles even in Spain? It still happens. Why? Because we are not distributing them equally. My view is, ultimately, it's a resetting of the agenda, it's a political choice. And here comes the paradox. Who will determine what governments need to do, because I invite you to read, I'm an admirer of Julio Frank. Julio Frank was Minister of Health in Mexico and was then the Dean of the Harvard School of Public Health. And he has published an article in the New England Journal of Medicine about global medical governance. And that's a very important point, global medical governance, because the sovereignty of a country is that the country can decide what they invest in healthcare, right? But you've mentioned Ebola, we mentioned Zika. It travels around the world, and suddenly we're stuck with a huge healthcare problem across the world, and then everybody scrambles to act. That's not good enough. So how can we make sure that political choices are made and that they choose for immunization? We at GSK, we work together with Gavi, Global Alliance for Vaccines, and there are clear criteria, and I will talk a bit about that, of when a country, a poor country, gets vaccines for free. But when their gross national income grows, and many African countries are in that state, then it's like university, they graduate from Gavi. That basically means care for yourself, look for the money yourself, and buy the vaccines. There's a gradual system of that. But what we see happening is that those governments don't choose for vaccination. They prefer to invest in something, whatever, but not immunization. So who will hold those governments accountable to make that? So that's one key barrier, actually, to get immunization everywhere, and a key challenge that I think we should be addressing, and we can help in that. Did you know, just to give some numbers, I don't have slides, but I want to give you a number, 24% of the disease burden is in Africa. Only 3% of healthcare workers are in Africa. And only 1% of the world budget is spent in Africa. So back to my earlier point, if we think that health and sustainable development goals can be achieved, it won't happen by just letting the market powers happen, or just talking about it, or just doing the same as we did yesterday. We will have to fundamentally change how we go about immunization, but how we go about global medical governance. And that's really the point I wanted to make, because otherwise we will be sitting here in 5 years' time and we will still say that 1 in 5 children don't have a vaccine, don't receive a vaccine. So that's about immunization, and I hope we all agree immunization, we can do more. It's not just about the price of vaccines, it's not just about sending vaccines to Africa, it's different. And that brings me to my second point, is the private industry. I started 30 years ago, I started when I was 12, in the pharmaceutical industry. And honestly, nothing was on the agenda then. It was actually, pharma industry was caring about 500, 600 million rich people in the US, in Europe. And nobody was talking about the 6 billion living out there elsewhere. I think today we need to be in sync with societal needs, and therefore we need to adapt our business models. And Dr. Pisani, you mentioned it. It's not like old philanthropy. It's not about signing a check. That's very easy. In my office, I can sign a check of money, send it to Africa and think I've done my bit for sustainable development goals. It's really about making sure it's part of the business model. And here is the point. It is not contradictory to bring value to shareholders and at the same time bring value to society. And for us at GSK, I'm very proud to work 25 years for GSK. Why? Because it's part of the reasons why I get out of bed in the morning. And of many of our people who work for us, definitely in vaccines. I had this morning a visit of some Flemish entrepreneurs. They were all impressed. They went on the shop floor in the factories and were so impressed about the passion of our people. You know why? Because they are not producing vaccines. They are saving lives of babies. They translate the number of doses they make into the number of babies. They even have a map on the wall where they indicate which village in Africa they have saved. That makes that we have actually, by putting it into our DNA, a huge passion with our people, and it actually keeps people with us. But just to give you an example, what does it mean having it in the business model and in the DNA of GSK? And again, I can use an external reference. The 4th time in a row, we've been #1 in the Access to Medicines Index. Why? Because we put different initiatives in place. The first one is tiered pricing. It was on the slide of Professor Temmerman. What does tiered pricing mean? It's very simple, actually. The rich pay for the poor. And we use the GNI, gross national income, of the World Bank as a benchmark. Those who have a better proposal, be my guests, but I haven't heard a better one than that benchmark to judge if a vaccine should be for free or at a low price, yes or no. And we ship our vaccines at the lowest prices to the poorest countries. We've never increased the price, and the price is at 10% or lower even than a price in a Western world. That's the rich pay for the poor. It's a message for European governments. It's a message for any government that runs a developed country. It's not about that you think you pay too much. You just need to take your responsibility and make sure you continue to fund that tiered pricing. Secondly, even when we make money in Africa with our medicines, which are at the maximum of 25% of the prices, we reinvest 20% in infrastructure and healthcare workers. So far, we have trained more than 25,000 healthcare workers, frontline workers, because that's where the need is. Our core business is innovation. And if we look into the world, we could say, well, let's innovate and then have it on the bench. No, our challenge is to innovate and make sure that it gets everywhere in the world, wherever they live, whatever they can afford. That's a philosophy within GSK, not just within vaccines, because that would be the easy part, you would think, because we ship so many millions of vaccines. But it's also true for our medicines. And even in consumer healthcare, I think Professor Temmerman will be very pleased to know that we have a simple mouthwash that we've changed into sterilization, actually, of the lumbrical cord for when mothers give birth. So across the company, when you put it in the DNA, it becomes part of your business model. And how does it work? It's just to make sure that you have the discussion with your board, that you have the discussion with your executive team, and that you make the balanced choices of how much goes in that business model, where you both do well for the shareholders and well for the world. Another example where I'm very proud of is malaria. We are the first company to put a malaria vaccine available, because I don't call it a market, nor selling it, because we won't sell it. We will put it available. That's a conscious choice. It was 30 years ago. 30 years ago, we started that research on there, and it was with ups and downs, and we're still not there. Yes, we have the European Medicines Agency approval, but we are now working together with WHO, with PATH, with the Bill and Melinda Gates Foundation, to make sure that we are absolutely sure that the vaccine, once we implement it in Africa, gets to the right people, has the right efficacy and the right safety. That really takes guts of a company to make that happen constantly and to make those choices. But let's be clear, we are a business, we're not a charity. And people think, yeah, I mean, this is just, you know, your philanthropic idea, and you still make lots of money. Of course, because we talk about sustainable development goals, and the only way we can get to sustainable development goals is make sure that not only the efforts in the developing countries are sustainable, but at the same time that the business is sustainable. Because if we don't allow, if the community, the governments don't allow the business to be profitable, then quickly the partnerships will fall apart and everything will not happen as it should happen. We have a responsibility there together. So for GSK, it's very important that we have innovation, which is our core business, and always marry it with access. But not one vaccine in the world, not one vaccine of GSK has been found, produced, brought to the people who need to be vaccinated on our own. It's through massive collaboration. Be it research collaboration, we collaborate widely in the world, also in Belgium with universities, academics. This is not a parity mission. This is based upon excellence. That's a message to all the academics. It's about excellence. It's not about being in Belgium. But it's working together and collaborating with the right people. And here I must say an example that we've seen is working together with vaccines with Vodafone, for instance. In Mozambique, we have a project where we can track the number of doses, where we can track the people where they are just by giving them a mobile phone. Why am I using this example? Because too often people ask us to pay for fridges in Africa because there's cold chain transportation needed for vaccines. My message to all of us in industry is stick to the knitting, stick to your business. What is our business? Our business is, for GSK, is finding, discovering, developing new vaccines. Also vaccines for the developing world. We have a special institute in Siena, Italy, researching with money of grants of Bill and Melinda Gates Foundation, of any other partner, to develop vaccines for the developing world. Stick to the knitting, that's what we do, and then make sure you have processes in place and decisions in place that those vaccines are accessible. But then all the rest, we work with partners, with UNICEF, with Save the Children, people on the ground who know how to bring those vaccines, with healthcare workers on the ground, with people who know how to administer those vaccines, and make sure that pharmacovigilance systems are in place and that we can track the work we do. So we need to leverage our combined work. And so here my message is collaboration is critical, crucial across the board. And Margaret Chan just got a call on the 28th of May. There was an assembly where the WHO was called to really look after that multi-sectoral approach. Because I can tell you, we were in the front line with Ebola, and it was chaos. Because the world was not ready to deal with a crisis like that. If we want to reach those sustainable development goals, that's what we need to do. So I see this, or at GSK at least, we see these sustainable development goals as challenges, but way more as opportunities. Opportunities, one, to encourage the political will, and we really want to count on the convening powers of governments and WHO, United Nations, to make sure that people are made accountable for what they do, because we are talking about the world, not just about a country. Secondly, inviting everybody to think about the business model you're in. I mean, let's make sure you're in sync with societal need, and it can be done. There's no contradiction between making money and doing good for the world. And last but not least, absolutely make sure that you recognize the multifactorial or the multisectorial need to be able to do what we need to do. I'm very positive because I've seen it on the ground. I see it in the many meetings that I have. From GSK perspective, I want to commit to really make these sustainable development goals happen, working together with Minister De Croo and the Department of Development with the charter that we will sign in September, where we make a clear commitment to collaborate in Belgium. In Europe, we are working together. You've heard from Dr. Pisani. I mean, at IFPMA level, next week I'm in San Francisco at the Bio Conference with the European Commission, talking how we can better innovate and work together to put our heads together to innovate, continuously innovate, because we need to continue to do that. And globally, we will continue to work with organizations like Gavi, UNICEF, and Save the Children. And I really look forward to being on that journey with all of you, and I hope you share the pride of me of having a Belgian company actually on the ground that really makes a difference in the world and can help to achieve those sustainable development goals. Thank you very much.